The views or opinions expressed on Ann Arbor Inclusive do not necessarily reflect the views or opinions of the City of Ann Arbor and the Commission on Disability Issues. For more information about the Ann Arbor Commission on Disability Issues, please visit a2gov.org/disability resources.
Hello and welcome to Ann Arbor Inclusive. I'm your host, Tom Hoatland. On today's show, we are very pleased to be highlighting the low vision and visual rehabilitation services at the University of Michigan's Kellogg Eye Center. The center helps individuals with all levels of vision loss, ranging from mild visual impairments to legal blindness. Their comprehensive, multidisciplinary approach to care provides a team of specialists who are trained to evaluate conditions and identify an individualized rehabilitation plan to help maximize remaining functional vision and maintain independence in daily living. It's my pleasure to have Dr. Sherry Day, Assistant Professor of Ophthalmology at the Kellogg Eye Center.
Thank
Sherry,
you.
welcome.
Thank you for having me.
Yeah, for sure. So why don't you tell us a little bit about your position with Kellogg Eye Center first?
So I'm one of the optometrists at Kellogg Eye Center who specializes in low vision. I did a residency in low vision for a year. Dr. Bricker and I are the low vision doctors there, along with Ashley Housen, our occupational therapist.
Okay.
The other members of the team are the social worker, as well as University of Michigan's one and only orientation mobility specialist,
Okay.
Russ Ellis.
Yeah, very cool. So what is low vision? I hear low vision, I hear legal blindness, and sometimes I hear complete blindness, which doesn't really sound like a diagnosis. But why don't you give us the range of what patients you see?
So low vision will include anyone with just reduced vision with best corrected glasses or contact lenses,
Okay.
where they're starting to have some functional issues because of their vision.
Okay.
Legal blindness is a definition in the U.S. You're 2200 or worse with best corrected glasses or contacts, or the other definition is your total visual field is 20 degrees or less.
Okay.
As it pertains to blindness, a lot of people will throw around the word blindness, this and that, but there are different variations of different degrees of vision impairment. So you could be severe, profound, near total, or total blindness where you probably don't even see light.
So Dr. Day, tell me what 2200 vision is and the different variations of low vision.
Right. So 2200 is someone who can see a letter at 20 feet, where someone with normal vision can see it at 200 feet away.
Okay.
So you could say their vision is about 10 times worse. So someone with 2400 vision versus 2200, they're twice as worse.
Okay. All right. And 2020 is what?
That would be the standard of just normal vision, no diseases, you're fully correctable,
Okay.
contacts or glasses.
All right.
20.
All right. So someone like me using glasses to see far away, you don't consider that visually impaired?
Nope.
And what is that?
Vision impairment?
No, someone who just
Oh.
needs glasses or contact lenses.
You're probably nearsighted or farsighted, or you need reading glasses because you're getting older.
Yeah.
So those are, if they're correctable to 20/20, that's normal vision.
Okay. So what is the purpose of low vision rehabilitation? What is that term?
Low vision rehabilitation includes the exam, the devices, any therapy involved to increase or maintain a patient's independence in their daily activities.
Okay.
So we customize our exams to the patient's kind of daily activities and their goals.
Okay. I was surprised to read and then hear you say about occupational therapist. I hadn't given that a thought, but now it makes sense because people need to go back to work and people need to go home and function. So
Yep. They have to cook. They have to, clean their house. They have to still dress themselves, groom themselves. So that's all included.
okay. And so tell me about a low vision exam that somebody goes through.
So patients, and you mentioned the multidisciplinary team that we have. So patients are usually referred to our low vision clinic by our in-house ophthalmologist or just community doctors. And once they come to us, the low vision doctors, like myself and Dr. Wicker, we will do a thorough evaluation as to the status of their vision. So, you know, what are their numbers, 20 what? The contrast, we need to know the contrast as well, besides the 20 whatever number that they have.
Yeah.
And we go through a list of questions that we need to ask about their daily activities, because like I mentioned earlier, we want to customize the time we have with the patients to achieve their visual goals, their activities. So there's optical device evaluation, there are electronic device evaluation, there's going to be time spent with the occupational therapist as well.
Okay, all right, so everybody has their own customized rehabilitation plan.
Right.
That makes sense. So we already talked a little bit about who comprises your team, but can you tell us the difference between an ophthalmologist and an optometrist?
Sure. Ophthalmologists are essentially surgeons. They, of course, do the diagnosis and treatment of eye disease, including surgery. Optometrists will diagnose and treat eye diseases as well, but we don't do surgeries.
Okay, at Kellogg?
Correct.
Okay. And as we can see, you have a lot of devices. So do you want to tell us about a low vision device?
Yep. So in general, with the exam, there are two main categories. There's the near vision and the distance vision, right? So we want to see the traffic light. We need to read. So for example, if we're doing the near devices, we're talking about reading.
Okay.
We could sometimes prescribe high power reading glasses like this for patients. And the difference is that this will focus way up here versus your glasses, you can just focus down here.
Okay.
Okay.
Those are really thick lenses.
Yes, they're very high power.
Yeah.
This type of is a magnifier with the light, and so you place it on the table. So if you're doing work, you don't have to keep holding it if you're reading something. Or this doubles, and you can use it as a handheld. So if you're going grocery shopping, you can actually take it along with you. It's portable. But this company makes it 2-in-1.
That would be really helpful in a restaurant with lighting that's dark.
Yes, absolutely.
I could probably even use it.
Right.
For a menu.
You're right. So spot viewing, price tags, menu, and the light brings out the contrast. It's very important in reading to have contrast, to increase the contrast.
Yeah. Yep.
So this is another, just a little. It looks like a little credit card.
That's nice.
But it's a 4x telescope.
Yeah, you can
magnifier.
fit in your pocket or a purse.
Yep.
Yeah.
It's very convenient.
Yes.
And then this is one that I wanted to kind of highlight, because the difference is this one, you can get your pen or something under there if you want to sign a document or if you want to write.
Okay.
And again, the light brings out the contrast as well. So these are more the traditional near work, magnifying devices. We can go into some of the electronics.
I'm curious about the hockey puck thing with the half.
Oh.
All right, what is that?
So all these are more kitchen safety devices.
Okay. All right.
So for example, if you're, most of these
Oh, I didn't see the handle on it.
measuring cups, right, most of these measuring cups have these tiny little numbers. They're very low contrast, and I mentioned earlier we need high contrast.
Yeah.
Black and white, it's easy to see. So what we've done, especially with puffy paint, is just to label it differently.
Gotcha.
So that it's big, it's high contrast. So we could do this with all your measuring cups. The other thing is, I find this fascinating. This is a cutting, like a safety cut. It protects your fingers when you're cutting,
fingertips.
right?
Wow.
And so this one, so a lot of people have difficulty kind of seeing where the water is, or if they're over pouring. So what you do is, once the water gets to a level, it'll beep, so you don't over pour the fluid.
Wow.
So these are just examples.
These are things we don't give a thought to.
Right.
Yeah.
So those are just things that, like our occupational therapist, she'll work with the patients on this.
Okay. And so let's talk about the electronics.
So these are just two different ones that I've brought just to demo, but there's a lot of different brands, a lot of different styles, a lot of different bells and whistles on them.
Yeah.
This one, for example, you can see that we can magnify. It's smaller, it's more portable, but we can change the contrast on these.
Got you.
Depending on the vision condition. That works the contrast that works best for them. The other beauty of this one is that it has a distance camera. Not everyone has that. So we could roll the camera and we could do distance far away, and it's all autofocus.
Yeah.
So this one is a bigger screen. It's a little heavier, but it's very clear. And what I like to highlight about this one is that it's got this line right here to guide in reading. A lot of my patients, because of the spots that they can't see through, they will lose their place when they're reading.
Okay.
So this line is very helpful in
That
keeping
is cool.
their,
Yeah.
So these come in color version, again, the different contrast as well, and depending on what works for the patient.
You know, so do these replace the big television type monitors that you slide under?
So I call that the desktop version.
Okay.
So they're bigger. They don't replace it because those might have other functions. For example, we have one in the clinic where it'll actually take a photo of a document or magazine page and actually start to read to you.
Wow.
So that's in the desktop version, I call that, the traditional CCTVs.
Okay.
And those come in different monitor sizes as well.
So shifting gears to the now to the patients, I understand you have a support group or a couple support groups. Can you tell us about those?
So we have what we call Living with Low Vision Support Group, and we meet every month, second Wednesday of the month from 1 to 3 p.m.
Okay.
We invite different speakers to come and kind of discuss different resources for our patients. So it's free to anyone who wants to attend. You don't have to be visually impaired to attend.
And do you have regulars that come back every month?
Yeah, we try to rotate them, but you know, there's so many people that come, and you know, we kind of invite back some of the ones that the patients really want to hear from as well.
Yeah, I was talking about patients that come, or people that come.
Yes. So a lot of patients that'll come, and they'll just come every month, and they've become friends. They've lent each other support. They discuss amongst themselves and different things that I don't even know about. So I'm learning through them as well.
Yeah, and so tell us maybe the last couple speakers, who comes in and talks. What is their specialty, or what are they sharing?
Some of the speakers we've had are disability attorneys have been here, kind of guiding us through some of the legal issues or the insurance issues, this and that, and who they can consult. So that's been very helpful. We've had Center of Independent Living directors come. We've had actually some of the electronic magnification companies come that patients want to hear from.
The manufacturers.
Yeah, the manufacturers, that's right. So we've had ophthalmologists come and talk about their research as well. And just this month, we had the research director of Kellogg, one of the project managers, come and talk to us about all the different types of research that's going on.
Yeah, give us an example of a research study that's going on now.
There's a lot of gene therapy going on, stem cell research as well. So those are just really cutting edge.
What about new technology just on the horizon? Is there anything exciting that is being developed? Anything new?
For low vision devices, absolutely. So this is a kind of device. It's a head-mounted device. It's called the eSight. It's difficult to turn on, and you won't be able to see what I see. But it's a head-mounted device. You wear it sort of upper, like above your eyes, so you can see under and walk while you are wearing it. But it's a distance and a near electronic zoom out device. Yep. So this is the third generation that we have. The other one we have is called the Orcam. Orcam was developed in Israel, and I don't remember which generation we have, but the most recent one, I think it's the third one as well. And this one has it looks like a pair of glasses with a camera on the frame. And when you point your fingers at a reading material, you hold it up like this, you point it, it'll read it to you.
Wow.
So that's in the clinic.
Is that out now?
It's out. It's out. We have it in the clinic. The other thing that we just ordered last week is the autofocus telescopic glasses. So it'll look like this, except it's autofocus. So some patients will use this, what we call the bioptic telescope, for driving. It's legal in many of the states in the U.S., but you have to be tested to qualify for it. But now there's an autofocus, whereas this is the manual focus. Traditionally, it's been manual.
All right, and why just one why not on both?
It's a good question.
Yeah.
The other side we leave open, so for your peripheral vision. A lot of our driving is based on a peripheral vision as well.
Okay, all right. And so does someone have to go through driver's training with
Yes.
those?
The Secretary of State certifies certain schools that you have to go through training with them to qualify to drive with this.
Yeah. I know I had to do that when I needed hand controls to drive the car. I had to go to a complete evaluation for that. So what other services does Kellogg offer to their patients?
Besides low vision, we have all the specialties in ophthalmology as well. There's retina, there's retina glaucoma, neuro-ophthalmology, ocular oncology as well, dystrophy clinic, there's pediatrics. And with some of the optometrists, we do specialty contact lens fitting for post-op, corneal transplants or anything like that, diseased cornea. So there's a lot of specialties there that I might not even know about.
Yeah. So you mentioned pediatrics. I was going to ask you the age range. Is there an age that you don't see?
In low vision,
in
low vision, I think my youngest child is probably 3 years old, and at that point, we really want to educate the parents as to the resources, the devices that are out there, in the youth services that they can apply for through the state. So it's really educating the parents to be proactive with their children.
Okay.
And the devices are different with kids because they're learning, the stage of learning is different.
Okay.
So as kindergartners, for example, their textbook is really big. Their reading material is really big. So if the kids want to hold it close, that's fine. But as they get older, we can use magnifiers. Then we can, as they can learn with the new devices, we can go there. We also work with the Washtenaw Intermediate School District with our teacher consultants for the visual impaired with the children.
Okay.
So we'll give them a letter stating what type of print, what kind of devices they should use, and the TCVIs will work with the kids.
What is that?
TCVIs, teacher consultant for the visual impaired.
Gotcha.
We have one of the best in Washtenaw County. So
You want to say their name?
there's 9 of them.
Oh, okay.
So I don't remember all of them.
we don't need to hear all of them, but that's great.
We have the best county, I think, in Michigan.
Okay. And the reason I asked about pediatrics is sometimes it just is to me, it's so cute to see a real little one wearing really stylish glasses.
Absolutely.
But how does a parent know, and at what point do they know that there's an issue? Because a baby or a toddler is not going to say, I can't see that.
Right.
So what are some of the symptoms or signs for a parent to know that their child might have low vision?
It starts with just the first exam when they're babies. Parents might not know if the babies are even nearsighted, farsighted, or if there's any other diseases going on.
Yeah.
But early intervention is always the best. So pediatricians sometimes will pick up major things as well. But I think bringing the child in, even babies, for a full exam every once in a while is great. Every year or two. Yeah.
All right. So that's just going to happen naturally. Is finding that out. Do you have any success stories about patients that you've seen or maybe you've heard about through your colleagues at Kellogg?
We have a lot of success stories, but I think some of the most interesting devices that that I remember prescribing would be, for example, a musician. They need to see, they're in the orchestra, they need to see the conductor, they need to see their instrument, they need to see their music. So we would use something like this bioptic telescope, but we would position it differently. We would, I designed one where it was inferior, and they can focus. The lens was mounted below, lower, because then they can see the music, and above they can see the conductor. So that's what I mean by every patient is different.
Yeah.
Every patient is customized. Their exam is customized, their devices is customized as well.
And I bet there are even more devices you couldn't bring.
Absolutely. This is just a sampling of each category that we have.
Okay, all right. Is there anything that you didn't bring that you'd like to share?
Well, I would have loved to bring the OrCam, but
you just ordered it.
Yeah, we just ordered it. So
yeah.
or the autofocus, the autofocus bioptic telescope.
Yeah.
The occupational therapist also works with stroke patients. So we have this big device, the big massive device, the Dynavision, and that's what she works with.
A Dynavision.
So it's a big monitor.
Big as a dinosaur?
Yeah, it's a big screen
Okay.
monitor. It looks like a big TV.
Yeah.
And there are programs where she could, it's the therapy where she can train the patients. You know, if they have a left side they can't see, she can train the patients to
From
scan.
the stroke.
Right, from
Yeah.
a stroke or something. So she can train the patients to look or to scan more.
Yeah, wow. If there's someone out there that feels like maybe their parent or their child or themselves has issues with low vision, how would they come to see you and your colleagues at Kellogg? How does that process work?
If you don't have an ophthalmologist in-house, we obviously you can have your ophthalmologist refer to the low vision clinic. It would be best if the patients brought or had the records brought in so that we could see what the eye condition is. So then
Records from their eye doctor?
Right, from the eye doctor. So we can see what kind of eye condition, so we can understand what kind of vision loss they have. Is it a central vision loss or is it a peripheral vision loss?
Okay.
So this is how we customize their exams.
All right.
And once they're referred in, we take it from there.
So can you tell me, for tech-savvy folks, if there are apps for phones and tablets?
Yes, there's a lot. There's a lot of free ones and some that are paid for.
Okay.
But let's first start off with just computer accessibility.
Sure.
So your iPhones, your other smartphones, the Androids, they all have accessibility functions on their phones.
Okay.
So you could pull that up. It could be bolder. They could zoom in. You can zoom out. You could sometimes it's text over, voiceover for the patient.
Yeah.
So that happens on the computers as well, the Macs and the HPs.
Okay.
And then beyond that, on your phone, you can download apps to help. So there are free ones. For example, Be My Eyes. That's one of the really fun and free ones. Where
How does that work?
Yeah, so you tap into the apps. Let's say you want to read what's on the menu. And you tap into the app. Whoever, the other end is a sighted person who is just volunteering. They're on the app as well, and you want to ask them to read this for you. So you use the phone camera to show the sighted person.
Wow.
And then just read it for you.
That's cool.
There is Tap See, another
Okay.
app where it can recognize a face. It'll say this is they'll look at you and say, hey, you're a 25-year-old man looking happy. So, or it can read to you. There's a QR code and it can read to you as well.
Okay.
There are some paid ones where, for example, Ira Vision. Very similar concept as the Be My Eyes, except that's 24/7 almost.
Okay.
They're trying to increase the time where the live person is there for you. So if you're navigating someplace and you just don't know where you are,
Yeah.
the person on the other end through Ira, the Ira app will help you navigate.
Okay. All right.
There's a free app called NFB Newsline that is a free news for anyone with a vision impairment. It can read to you voice as well.
Okay. The news of the day?
Yes.
Yeah. Wow, that's fascinating. Yeah. There's so much, between all of these things, there's so much hope and functionality for folks with low vision. I learned a lot. Today. So it has been a pleasure meeting and talking with Dr. Day. From the specialized faculty and staff to the technology and the support group, Kellogg Eye Center is doing great work in our communities. My personal takeaway is that Kellogg Eye Center is treating people with low vision to ultimately maximize the independence of people with low vision. I'm sure today's show will inspire someone in our community to get in touch and address their low vision issues with Kellogg Eye Center. For the Council on Disability Issues, I'm Tom Holtland. We hope to see you next time on Ann Arbor Inclusive.